There were a number of issues that came out during this meeting related to the management of prostate cancer, starting from the use of MRI in the identification of possible prostate tumors. It was very evident at this conference that MRI is here to stay, that patients coming in with a PSA which is increased, they should be first screened with the MRI to see if there is a lesion which is suspicious for prostate cancer. If that is the case, the biopsies should be done using fusion techniques. This is important because by doing this, we have reduced the number of patients undergoing unnecessary biopsies, and this is clearly important in everyday practice. This is a meeting which is specifically dealing with the management of advanced disease, generally speaking. So going back to that debate, the big thing was the comparison between the use of oral agents as compared to intravenous chemotherapy in treating patients with present with hormonal naive cancer, which means at first diagnosis, patients present with metastatic disease. Usually they would be treated with hormonal therapy only, and now there is initial evidence suggesting that if one is adding chemotherapy and if one is adding Abiraterone, which is an oral drug also working on the line of testosterone, then results will be better. Clearly this is important because these patients are actually receiving a better expectation of survival, and it takes more time to become so-called castration-resistant patients, so they do no longer respond to the classic therapy of hormonal treatment. And so it is something very new. What we do not know now that these two options are available is which one the patients would like to receive first. And when discussing this with the speakers, they did not have the opportunity to say this will be the best one or this will be the best one. But indeed, this is something new for the patients itself, so it is important. And time will tell. There is also a financial issue behind, because clearly chemotherapy is now administered using generic treatment, and so it does cost less, while this new form of hormonal treatment with the pill is still under patent and the cost is higher. It will become generics in a couple of years, so this issue of the cost of treatment will no longer be important. I would summarize that urologists, medical oncologists, all those who take care of these patients must remain very updated, because there are so many things that come in and they are published in the literature every month, and things are practice changing, so that it is important to follow that line.